Okay, Keisha, so after reviewing your x-rays, you have two new cavities in between your teeth. So, would you like to schedule an appointment to have them filled? Doctor B, tell me something now. Since you're going like, you know everything. One of dentists tell people to brush them teeth every day and a little flow something. Look for that in the toothpaste. I'ma do that. So all comes now, you got to say look past some x-ray. Yeah, look at x-ray something. And telling me only have cavity in between my teeth. What I have to do with now, I brush my teeth every day. I want eat a little sweetie and so. You make your breath smell fresh, you know. I'm a little chewing gum so nobody can talk to me because my breath ever fresh, ever clean. So, how comes make money? How comes girl? Have cavity. How come me have cavity and me clean? But me brush my teeth. You have time? Okay. Hi, it's your girl, Dr. B, aka the Rasta Dentist. And today, on this episode of Smile Look, we're gonna talk about why, even though you're brushing your teeth and flossing your teeth every day, you're still getting cavities. Before we get started, don't forget to subscribe to this channel. Guys, come on. Before we go into why you might be getting cavities, it's good for us to talk about what is a cavity. Cavity, also known as tooth decay, and by the scientific word dental caries, is a term used to describe the breakdown of the structures of the teeth due to a bacterial infection. In this case, the bacteria feeds on the food you feed on and produce acid. And this acid is what is responsible for breaking down the structures of the teeth and forming what we know as a cavity. A cavity can take on many different forms. At first, a very early carious lesion or a tooth decay starts off as a white patch on your tooth. If it gets a little bit deeper, it becomes a darker area. You may see like dark lines on your tooth, and then eventually it forms a hole. For decay to happen, there must be three factors involved. The bacteria. Every human on earth has the decay causing bacteria as part of their natural oral makeup of bacteria. The second thing it must have is a source of fuel, that is, the sugar that you consume in your diet. The third component for forming decay is time. So if you have time, sugars, and bacteria, then tooth decay is inevitable. But there are some things that you could do to reduce your risk of getting dental caries. So, what are the real causes of dental decay? Well, the first thing that may come to mind when you ask any dentist about dental decay is your oral hygiene routine. This is not a dirty girl. I brush my teeth and sometimes I'll 2-3 times a day I brush my teeth. How come? You girl, I talk about cavity. Yes, you're brushing every day, but are you brushing effectively? Are you reaching all the surfaces of your teeth? Most of my patients, when they come into the office, I see that they really do make a genuine effort to brush. However, when I look at most patients, they brush the front surfaces of their teeth. So they brush for everybody else to see. But are you also brushing the inner surfaces of those teeth? The surfaces that touch the crown? Are you also brushing the biting surfaces of your teeth? The surfaces that touch together when you chew food? Are you closing slightly and making your toothbrush get to the back of the very last tooth? All of these things are things to consider when you're brushing your teeth. I want you to go in the comments right now and write down if you want an in-depth oral hygiene routine. So, yeah, oral hygiene routine is one of the most important factors that is going to determine your risk of getting tooth decay. Also, even though you're brushing every day, are you flossing? The not time for floss, but what are time for floss? Is you flossing? You? Yes, you. Did you floss today? Yes, the flossing. No, that took up too much time. Plus, when you floss, my gums don't feel. They become uncomfortable. So, you have to show me that floss is up. Brushing only cleanses 3 out of the 5 surfaces of a tooth. The outside surface, the inner surface that touches your tongue, and the biting surface. So what about the surfaces in between? What about in here? That is why flossing is important. Without interaction with floss, at least once a day, you're missing out 40% of your tooth surfaces. You're cleaning only 60% of your mouth. 60%. Do you really want to be a 60%er? I thought so. If you want your smile unlocked, you gotta floss. Additionally, what type of toothpaste you're using? Are you using a toothpaste with or without fluoride? Now, fluoride is one of those controversial topics in dentistry, but from my personal experience treating patients that both use fluoride, does not use fluoride, there is a significant difference. And I am erring on the side of science. It is a proven fact that fluoride is good for your teeth. Fluoride has a powerful local effect where it helps to reinforce the strength of the enamel. So using a toothpaste that has a significant fluoride content is really good in helping to strengthen that enamel and making it more resistant to decay. Another way to incorporate more fluoride and hence more strengthening power into your oral hygiene routine is by using a mouthwash that contains fluoride. Did you know that all mouthwashes are not made the same? Every good girl uses mouthwash. You know what I'm saying? Go to the grocery, pick up a mouthwash and use it. Most of the mouthwash products on the market cater for the health of your gums. If you read the label, you're going to see words like gingivitis, gum disease, gum health, total care, but there's no mention of the teeth. Yeah, me, I'm a cavity. I don't know what about the powered palettes. I can't even pronounce the alphabet. Let's say total whole mouth healthy, so that must be good for the teeth. That's my boy. I'm not sure that bubblegum. My bubblegum, I still have enough juice. When you're shopping for your mouthwash, you want to look for words like anti-cavity, fluoride, enamel health. Mouthwashes that contain at least 0.02 to 0.05% fluoride. God no! To reinforce that enamel. And to be honest, it will reverse some of those smaller cavities that are confined to the enamel alone. So for anti-cavity, fluoride, enamel health, strengthens enamel. Oh good, replenish, natural. Oh good, then you have better for the teeth. Oh, you have a look of flow somewhere, let's say. Must have the toothpaste. Oh, you are going with good things, man. You can maintain an impeccable oral hygiene routine by brushing twice per day for 2 minutes long with a soft toothbrush, flossing at least once daily, and by using a mouthwash that contains fluoride. You are well on your way to living a cavity-free life. Living a cavity-free life is more than just a good oral hygiene routine. So, come back again next week for part 2 of this video, where we talk about some other reasons why you might still be having cavities even though you brush your teeth. So, I hope today was helpful for you guys, and Keisha, thanks for asking me questions, because you know the people them know how to explain to me that. You try follow the rules one where you make, like with a brush up in the back and the front and so you do that and the front using a brush in the second. So thanks for teaching me, because you never know when I could do that for myself. I'm not the kind of friend that talk. I'm really saying that. Yeah, and you have no excuse not to have your smile unlocked, because you need to make your cavities on. Yeah, this is Dr. B tuning out. This was another episode of Smile Unlock. Don't forget to subscribe and like this video, and you can follow me on all social media platforms at Raechell-Ann.